Crohn's disease is a chronic inflammatory disease that affects the gastrointestinal tract. It's named by Dr. Burrill B. Crohn, who first described the condition in 1932. Crohn's disease can affect any part of GI tract, from the mouth to the anus, but it most commonly affects the small intestine and the beginning of the large intestine, colon. So the exact cause of Crohn's disease is unknown, but it's believed to result from a combination of genetic, environmental, immune system factors, since considered an autoimmune disorder where the immune system mistakenly attacks healthy cells in a GI tract, causing inflammation and damage. The most shocking fact about Crohn's disease is that inflammation is transmural, meaning it penetrates through the entire thickness of the intestine wall, all layers, from the inner lining mucosa to the outer surface serosa. So this is what allows the increase to literally create tunnels and holes connecting the gut to places it should never be connected, of course. Unlike ulcerative colitis, which causes a superficial inflammation limited to the colors in inner lining, Crohn's disease is a deep, burrowing, destructive process. This transmural infection leads to the most devastating and unique complications. Strictures. As the deep inflammation heals, it creates thick, circumferential scar tissue that narrows the intestine, leading to a bowel obstruction. Fistulas. So the inflammation can tunnel completely through the wall, creating an abnormal connection or tunnel to another part of the body. So this can be enteroenteric, from one lobe of intestine to another. Enterovesical, from the intestine to the bladder, causing patients to pass air stool in their urine. Enterovaginal, from the intestine to vagina. Enterocutaneous, from the intestine to the skin, causing feces to drain a hole in the abdomen. So it's like a 3D disease. It's not just a surface problem. It's a three-dimensional architectural destruction of the gut. The conception of the intestine literally building tunnels to other organs is a profound and horrifying pathology. It explains everything. This single fact explains almost all the key differences between Crohn's disease and ulcerative colitis. It's why the Crohn's causes strictures and fistulas, while ulcerative colitis, being superficial, does not. It's why Crohn's can cause abdominal masses from inflamed matter, loops, or bowel, while ulcerative colitis does not. And actually, it's a surgical nightmare. The penetrating nature of the disease makes surgery incredibly complex. A surgeon isn't just removing a diseased segment. They are dissecting a mass of inflamed, scarred, and abnormally connected tissues. Yeah, it's a nightmare. Stay blessed.